Good afternoon, everybody. We are here at M3 Physical Therapy Recharge Performance to meet with Dr. Gray, and today is our spotlight for today for Women's Small Business Month. So let's go on in and let's find out all about M3. Hey, Dr. Gray, how are you?
I'm good. How are you?
I'm good. I'm good.
Awesome.
Good to see you.
Well, welcome to M3 Physical Therapy Recharge Performance here in Rowland. And how about I give you just a quick little tour of what we got here and what we do?
Perfect.
Okay. Well, I'll just kind of start left to right. This is kind of like what they used to call a little cardio room. Now it's just kind of a hodgepodge, but we have the fun little rebounder and a couple TRX pieces of fun equipment and everything like that. And then don't be afraid of the kettlebells. We don't make everybody with those.
Kettlebells, great workout.
For the most part. Lots of good room. We have a lot of fun out here. It can get pretty busy sometimes, but not so busy that it's extra crowded, or we are still keeping 6 feet away for the most part with all of our patients too. But yeah, this is kind of the main gym. And then we have a couple little treatment rooms. I gave myself the tiny room over here because, you know, that's what the boss does. But I have a little tiny eval room, and then the two larger rooms, and we have patients in them right now, so I can't necessarily take you back there right now.
Yeah, it's understandable.
Well, actually, I think I can in this back one. Craig has somebody right now in here that he's treating. But Judy, are you back here? She's hiding. But this is Judy's room. And Judy is my licensed massage therapist, and our patients will tell you her hands are amazing. She does fantastic work, and everybody loves her. So she's been a huge blessing to this practice. But anyway, that's her room.
Okay.
And then, so things that we do that we like to focus on, we are more functional with our treatments and everything. As you can see, we have warm-up equipment, but you know, besides a little leg machine over there and a leg machine over there, for the most part, everything else you know patients can do on their own at home. And that's just the way that we want it, because if they're requiring a whole lot of equipment, they're not going to be able to do their exercises. So and then we do send them home with TheraBands or anything else that they might need, and that's not an extra charge. It's just whatever they need to get the job done.
Okay.
So like I said, we stay pretty functional here because we are functional beings. And then on top of that, besides having Judy when needed for tissue work and everything, we do neuromuscular dry needling. I can show you. So we have a couple little things that we use. So I've got one in my room, and Craig has one in his room, but this one needs more cotton balls. But neuromuscular dry needling is really cool. We get really fast results. They're acupuncture needles, so they're little monofilament needles. They're really tiny, and it's not like acupuncture where we're sticking 60 needles in at one time, or going after meridian lines or anything like that. We're actually going after specific neuromuscular junctions. So less needles, more specific. Our patients will notice a difference within immediate to 5 to 10 minutes later.
Wow.
And it just really just gets those tissues to relax very, very quick. A lot better than going in there hands-on, and way, way better than actually just trying to stretch something.
So what kind of injuries do you treat with that?
You name it, we can treat it.
Really?
With that. Oh yeah, oh yeah. Craig and I have both been trained for dry needling and everything, and we use it throughout the day, every day. In fact, I was just thinking yesterday, I was like, I actually made it through the day and I didn't dry needle anybody. Ooh, that was weird. So yeah, it works really well. We do that, and then in conjunction with Judy doing the tissue work. Also, the other therapist, Craig, which you didn't get to meet yet, he's fascial stretch certified. So that is another way of stretching those tissues that a person can't do on their own. That's getting in there and really working on that deeper fascial level. And it's kind of nice for the patient because just like massage work, they just get to lay there and be passively stretched. But like I said, it's a form of stretching that you can't do on your own, and it's way more effective than just stretching on your own, which is only about 10% of the job. So yeah, needles. Those are a good time.
Oh, wow.
Some people are scared of them at first, but nothing to be scared of. It's actually fairly painless. So, for the most part, that's kind of it.
Okay. Well, I have a couple questions then.
Yes.
So, do you have to have a prescription from a doctor or a referral from a doctor to come here for treatment?
So, finally, direct access happened in Texas last fall. So, for the most part, most insurances don't require a referral from the doctor. They can just come on in, and we have 10 working days to get some kind of progress with them. What I do, though, is after I do the initial evaluation, I fax the note off to their PCP, and their PCP signs the note and then faxes it back, and that's kind of the same as the script.
Okay.
So that just makes it more convenient for the patient. But there are some insurances that do require pre-authorization first from the insurance company and do want a physician signature first as well.
And you guys handle the insurance side of it, the filing and stuff?
We do, yes.
That's nice.
We do. And then so we do have patients call in, and they want to know, well, what's my copay going to be, or just random questions like that, which I can totally understand because I'd want to know what I'm responsible for before I even start. The problem is that it does take time because everybody's insurance is different, and just because you and I have the same insurance, we don't have the same insurance.
Right.
So there's just so many different little nuances between within the insurance company. So we do have to call that stuff in or have to look it up online. So if anything to say to patients is, don't be offended if we're asking for your name and your birthday and all the information on your insurance card, because that is required to find out the exact information that they want to know.
Okay. Then how many physical therapists do you have working here?
So there's me, and then there's Craig. He's my physical therapy assistant.
Okay.
And so just us.
Awesome.
But then, like I said, Judy, and then Miss Holly up front, who is working the front computer, and she answers the phones and initiates all the insurance verifications and the scheduling. And her job can be pretty hectic sometimes because
Nice.
she's in the middle of doing 5 things, and then people are calling in and then wanting to pay co-pays and stuff. So
And you can get massage therapy covered by insurance too?
ha.
Maybe,
So-
maybe.
Yes. Yes and no. So that is something that we discuss with our patients initially. Now, if it's somebody just off the street, so Judy actually does see people outside of therapy. So, if somebody wants to come in for a massage and they don't want to have therapy or even be, have none of that, I just want a massage, that's fine. We can schedule, and we have those prices, and those are on our website at m3therapy.com. But otherwise, if it's a patient coming in and part of their treatment is tissue work with Judy, that is in effect covered by insurance because she is working in conjunction with us, and we are giving her specific rules and orders and things to do that we want her focusing on. So it's not you're not going to come in, and have your therapy for 30 minutes and then have like a nice full body massage and things like that.
Oh.
I hate to say.
Not that relaxing massage that my wife likes.
Right. She does it though.
Okay. Well, anything else you want to share? Where are you at? How do they get a hold of you?
Oh yeah. So where are we at? We are on Lakeview Parkway. So I'll give Opa and Amelia's a plug. We're in the same building as Opa Greek Restaurant and Amelia's Mexican Restaurant. But yeah, on Lakeview Parkway, and you can call us at 469-814-8126, and then find us online at m3therapy.com.
Awesome. Well, again, thanks for letting me come out, and congratulations on being today's Spotlight.
Well, thank you so much, Michael. I really appreciate it.